This is a model of human spine. As you can see it, the spine has three sections. The top section has 7 vertebrae. That is called a cervical spine that belongs to our neck. The midsection is called thoracic spine, where our ribs are attached. And in the lower section is called low back or lumbar spine, which has 5 vertebrae. And the last but not the least is called sacrum or tailbone. In spine, we have a segmentation. That means the bones are separated by cartilages. Cartilages are called discs. When injuries occur or the displacement of the disc occurs, it changes its position in relationship to the bone. Since spine is not just a bony structure, it also harbors nerves. Those nerves can get pinched because of the displaced discs, and those can be either discs or bone fragments, or could be arthritic spurs. When discs get displaced and when they pinch on the nerves, there are certain outpatient surgical procedures that one can perform to so-called unpinch the nerve. In neck, it is called anterior cervical discectomy. Anterior means front of the neck, cervical means the neck itself, and discectomy is removing the disc. In such procedures, after the disc is removed, a piece of bone is fashioned to fill the gap. And that bone, when it is inserted, is stabilized with a piece of plate and a screw. Those plates are made of titanium. These operations can be done successfully as an outpatient. It usually takes between 1 to 2 hours to perform such procedures. They are done under general anesthesia. And when the patient wakes up, they usually get immediate relief of their pinched nerve pain. So they may have some surgical incisional pain, but the original pain that they came in with disappears very quickly. In a similar fashion, in a lumbar spine, when the nerve is pinched, the disc or the fragment of the disc is pushed into the space where the nerve sits. Those procedures can also be performed as an outpatient. Under microscope, a very small incision can be made so that the distance between the bone above and bone below can be widened by removing some portion of the bone. And then under the microscope, a piece of disc can be located that is actually hurting the nerve. When those fragments are removed, patients get immediate relief of their nerve pain, sometimes also described as sciatic pain.